Mr. Speaker, I rise today in opposition to the proposed 3.37% Medicare fee cut. When a physician sees a Medicare patient, they do so out of the goodness of the heart. They care for the patient. It doesn't make financial sense. When you see a Medicare patient, when you see a Medicaid patient, you actually lose money. It costs more to see a patient than you get in the cost of care. When I ran a private practice, I stayed up many a night, Saturday nights, trying to find how to squeeze out money, find each paper clip, make sure that we knew where the staplers were, just to make sure that we made payroll, that we paid the light bills. Oftentimes, I did not take a salary when we could not do that. But that was private practice. We were our own destiny. We knew how to take care of patients. We had ownership in patients. When adjusted for inflation, over the last 20 years, the Medicare fee schedule for physicians has been cut by 20%. What other profession expects to be cut year after year rather than receive raises, especially in the time of this time of the inflationary period? Obamacare's directive, one of them, was to starve private practice, to force them, to drive them into employment. My former practice is employed now by a hospital. They've done well, but this is an entirely different tenet with patient care. Physicians are being cut every year in their pay. Hospitals, albeit smallly, get raises every year. This will still not be as much to carry the cost of care in these hospitals, but why are the people who are providing care to the patients, the ones who are being cut? Why is this a bad model? Because I think employed physicians tend to be a different bird than private practice physicians. They tend to be more working on the clock. They tend to decrease efficiency, and they actually increase the cost of care. There is much more ownership with private practice and physicians. When a private practice physician comes into a community, they establish roots. They become part of the community. They join churches. They join civic groups. Unfortunately, the employed physician model, as we see it now, is much more transitory. There's a contract. If that doesn't work out, you move in 3 years. And then patients are left in the lurch. My doctor. It's always my doctor took care of me for 20 years. That is starting to stop. That is ceasing. The Medicare fee schedule cuts must stop. This is why I introduced H.R. 6683, Preserving Seniors' Access to Care Act. The legislation stops this year's cut while we work on a permanent solution. Mr. Speaker, this is one of the reasons I came to Congress, to fix Medicare. We're experiencing a critical doctor shortage now. It is going to be off the cliff in 3 to 5 years, especially with surgeons. No other profession, as I just said, expects to be cut every year rather than get raises. Every day now, we add 10,000 new patients to Medicare. I'm sorry? I'll finish just a second. Imagine a hardware store where you bought a hammer for $1.
The gentleman's time has expired.
And you were paid 60 cents. It doesn't make sense. I ask my colleagues to support the bill. Thank you, and I'll yield back.